My name is Michael Cain. I serve as Vice President for Health Sciences and Dean of the Jacobs School of Medicine at the University at Buffalo in Buffalo, New York. I just had the opportunity to present a lecture entitled New Electrocardiographic Indicators for Predicting Sudden Cardiac Death at the International Academy of Cardiology's 2017 annual scientific sessions. The main thrust of this presentation was looking at new non-invasive ways to identify patients with modest heart disease at risk for sudden cardiac death. And the new approaches that I discussed were ways to extract information from the standard 12-lead electrocardiogram that define global electrical heterogeneity, which is the non-uniformity between the wavefront of cardiac excitation versus the wavefront of cardiac repolarization. And in work done by a group that worked through Johns Hopkins and then through the University of Oregon at Portland and led by an investigator named Larissa Terenchenko, they identified 5 metrics derived from the standard 12-lead electrocardiogram that were then tested in over 20,000 patients who had modest but not severe heart disease. And the outcome of using these 5 electrical measures was that the ability of these measures to predict those who would go on and develop sudden cardiac death was very, very powerful and was actually stronger than some of the more traditional measures, including left ventricular ejection fraction. So the main take-home message of this was that in the last 20 or 30 years, the target of trying to identify who with heart disease would go on and develop sudden cardiac death focused on those individuals who had severe heart disease. There's actually a larger group of patients who die suddenly who have modest heart disease, but this group over the last 20 or 30 years has primarily been ignored. This new approach using non-invasive measurements from the standard 12-lead electrocardiogram allows us now to target everyone in the population, those with very sick hearts and those with modest heart disease, with increasing powerful measures to better identify those at risk for dying prematurely and dying suddenly.